Take control of your cholesterol. An estimated 8 to 10 million people in the U.S. struggle with bad cholesterol levels. Here to help us understand the effects that it has on our bodies and what we can do about it is Dr. Harold Bays and also Peggy O'Connor. She is a patient living with high-low density cholesterol. Good morning to you both.
Good morning, Stephanie.
So, Dr. Bays, what we are talking about here is bad cholesterol, and today you kind of want to shine light on an injection that has just been approved by the FDA, right?
Yeah, that's exactly right. I've been working with cholesterol-lowering agents developing these types of new therapies for over 2 decades, and what we have now is we have this first member of this brand new class of cholesterol-lowering drugs. And as one who helped develop the statin drugs, you may remember, this particular agent, this particular drug lowers that cholesterol to the degree that somewhat matches that of the statin. So it's something that's we just haven't seen before. And as far as like who it's used for, if you have a patient that has very high cholesterol because they have a genetic abnormality, or if they've had a heart attack, and in both cases, if they're already on a statin and they're at the maximum tolerated dose of the statin and they're still not at their cholesterol goal, I mean, what's the patient and what's the clinician to do? Well, in this case, one of the things they can do is this treatment option of this FDA-approved agent, this Praluent, to add on to the statin therapy.
And Peggy, I know this is great news for you because you've had this experience living with high cholesterol. When were you first diagnosed?
Well, I was diagnosed a number of years ago, and in 2011, along with having already tried lifestyle changes with diet and exercise, I wasn't able to get to my goal, so we added the statins, and in doing that, I still was not able to get to my LDL bad cholesterol goal, and in 2012, I actually had a heart attack and was still not at my LDL bad cholesterol goal. So in 2013, in talking about this with my doctor, she gave me the opportunity to join this clinical trial for Praluent. And the first 6 months was a study. And after the study was done, I began open label use of actually using the medication. And so for the past year and a half, I have been either at or below my LDL bad cholesterol goals.
Well, congratulations on that. That's fabulous news. Dr. Bays, if you would take a moment to kind of explain what bad cholesterol is, you know, what is it for people like Peggy having to live with bad cholesterol? What kind of effect does it have on your
Well, I think there's two aspects. One, obviously, from a health perspective, physical health perspective, it's challenging because, as we know, if your cholesterol is too high, that increases your risk for heart disease. All right. But the second thing is, I think that people do need to realize that if you have a genetic abnormality wherein your cholesterol levels are very high, we call that familial hypercholesterolemia, then while I think nutritional intervention is great and increased physical activity is great for a whole lot of health reasons, it may not do much for your cholesterol. Now, for most people, there will be some benefit with regard to your cholesterol levels, with those types of interventions. But my point is this. When you've tried the lifestyle things and you're on the maximally tolerated statin dose and you do have a genetic abnormality where your cholesterols are really high, or you've had a heart attack and your cholesterol is not where it needs to be, then we need to look at other options. There needs to be other options available, not just for the clinicians, but for their patients. And in that case, Praluent would be one of those options.
Well, and as we close here too, Peggy, what would you say is maybe the most important thing for patients, especially going through this clinical trial that are really wanting those same results that you had? What do you want these other patients to know about high cholesterol and Praluent?
Well, they need to talk with their doctor, and hopefully they've been talking with their doctor about trying to reach their LDL goal. And in this day and age of technology, there is a website. It's www.praluent.com, and that's Praluent. And they can go on to that website. They can learn how it's administered, because it is an injection once every 2 weeks as opposed to taking a tablet. and they can learn more about the medication, but then also speak with their doctor about whether this is a valid option for them.
Yeah, so certainly go online and explore these resources out there. Dr. Bays, what would you say to anyone out there who is going through this? Is the best place to maybe start online with the website Peggy talked about? Obviously, keep open dialogue with their doctor.
Well, yeah, I would certainly agree with that as a doctor. Yeah, but Stephanie, I think you're spot on. Many times people will nowadays want to be, educated. They want to be enlightened. They want to know more about what they're getting themselves into or what options might be available to them. So I think starting out at the website's a good place to go, but then also talking to their clinician. Talk to their doctor, talk to their nurse practitioner, talk to their physician assistant, whoever. Get the information, see what's right for them.
Yeah, certainly important to keep that open dialogue with your physician. Thank you both so much. We wish you the best, Peggy. Thanks for joining us.
Thank you so
Stephanie.
much.
We're going to have more posted on our online. Just go to our website to learn more, fox4morningblend.com.
And we will have one last check on today's Fox forecast and then be right back.